explaining the circles, or at least the class of the wrist, okay? So the wrist is one class. It's a biaxial, this is kind of a review from 310, a biaxial ellipsoid joint, meaning that it can move in two of its planes, it can move about two of its axes, so we account for four motions. The key thing here, the main thing here, is you do not see polar axis motion at the wrist, right? You see the what represents the polar axis, and there's NA, right? That doesn't mean non-alcoholic. That means not applicable. And that's confusing to some people because people want to give credit for wrist motion here. You know, elbow, elbow, wrist, wrist. It's so tempting to want to give credit to wrist motion here, but this is not the wrist. You do have some orbiting of your radius about your ulna. That's radial ulna. You have a proximal radial ulna and you have a distal radial ulna. You cannot, and if you do, bro, we go into the circuits, you cannot stabilize your forearm and passively twist your wrist. Try it. I can passively flex extend, I can passively radial ulna deviate, but I cannot passively twist my wrist without moving my forearm. Okay? So that's extremely important, that we understand that the wrist can only go sagittal, the wrist can only go frontal, it cannot go transverse, the wrist joint itself. And the reason it can't go transverse is because it's splinted medial and lateral with some ligaments. And don't allow that. Guys, think about this. True or false, we are wired extremely high for the dexterity we have in our, when I mean wired, we have a lot of nerves that run in here so that we can have these fine, intricate motions. The nerve to muscle innervation ratio, right, is very low so that we can do this. Does it make sense if we had all this wiring that we would want to be able to spin it like this and then twist it in all the vessels and all? Of course not. Like, we need to keep all of those fibers where they're at. We don't want to take the wrist and twist it like a balloon animal. Okay? If you remember from 310, I told you that the pinky will always be on the side. Always. You can't deviate it, and that's one of the reasons why. It's because it's splinted, and the thumb is always going to be radial side. If you could spin the wrist, then I could spin my thumb over to my ulna. Okay? So I'm just showing you different ways for you not to forget that the wrist does not rotate in the transverse plane. If your wrist rotates in the transverse plane, that is a bad day for you. Okay? It's a bad day for you. So, if we don't have to worry about the polar axis of the wrist, we don't have to worry about rotational functions. Remember, like we did for the sternos and stuff, right? There's no rotational arrows. So that actually makes this class kind of more straightforward. We're looking at a cross-section of the wrist that sits like it's supposed to on your desk, meaning that if your wrist literally were to magically go through your book, you'd see a cross-section. I have to rotate it so that we can all see the same thing, right? So this would be like your wrist was sitting here on the board. Anterior muscles that cross, posterior muscles, medial muscles, lateral muscles. Everybody understand that? Strings or muscles that cross in the front of the wrist are going to pull in the direction of wrist flexion. Those are going to be our wrist flexors. Muscles that sit across in the back of class, the posterior, those are going to be our wrist extensors. Medial crossing muscles are going to be ulna deviators, and the lateral crossing muscles are going to be radial deviators. Now, some of you may be like, well, why is this a right wrist? What about the left wrist? Well, the left, we're going to infer normal distribution of muscles. The left got the same stuff as right. It's just a mirror. So you don't have to be redundant with these circles. In other words, even if I give you a left wrist question and you say, if I have a weight in my hand, I say, hey, which muscles are keeping that weight? You're like, well, the weight is, the external force is trying to flex me, I need extensors. Guess what? The left extensors are the same muscles as my right extensors. So once you identify muscles on the left, you can still reference a right-sided circle to name those muscles or to see function. So you don't have to be redundant. So why did I pick right? Because the majority of you silly cats are right-handed, even though I'm a lefty. Okay? So you don't have to mirror it. You can reference the same functions off of a right-handed circle. So because this is our right, this is lateral, this is medial, anterior, posterior, all the deviators, radial deviators, flexors, extensors. Cool? So just like with our cervical and our trunk, we had multifunctional muscles, right? We have muscles that were what we call quadrants. Someone could sit in the front of class, but they could also sit to the right of class. Anterolateral or posteromedial, front left, back right. It's the same thing here. We have some muscles that sit in the front and to the right. They're going to have two functions. How do we communicate a muscle that only has one function? Well, let's look at this ED muscle. Okay? It's going to stand for extensor digit. We have a muscle that goes out to the digits that pulls in the direction of extension. Well, this muscle sits in the back of class. It sits posterior, so we know it's going to pull in the direction of extension. However, it sits neither medial nor lateral. It sits the fence, if you want to look at that axis as a fence. And as we know from layman's terms, if someone sits the fence, they don't make a decision, they can't make a choice. Right? So this is how we communicate one function of a muscle. It sits posterior, but it is neither medial nor lateral, so this muscle does not pull in any deviational because it's right on the axis. Make sense? Okay. Guys, the wrist, to me, is probably one of your easiest circles of function because so many muscles have function in their name. Not all muscles do, but a lot of them do. I'll give you an example. Flexor carpi radialis is a muscle that I'm about to show you. And we'll talk about where it starts and where it finishes. Flexor carpi radialis. A muscle that crosses the wrist, that pulls in the direction of flexion. It pulls on some carpal bones, and it runs along the radius, which is on the outside, so it's lateral, so it pulls in the direction of radial deviation. Like, some of these muscles are laughable at their function. We're going to get to a muscle on Wednesday probably called the supinator. Yeah. If you missed that question, I'm taking back your 86. What does the supinator do? Now, the only way that can get confusing is if I say, like, what's the function of the supinator through eccentrics, right? You know, where I try to, it's like still a supinator. It pulls in the direction of supination. But a lot of these muscles, guys, have the function in their names. Flexor digitorum. Even a muscle like the palmaris longus that I'm going to show you. Palm, where's your palm? It's the front. So the palmaris, pulling on your palm, pulling in the front. Just a lot of insinuation to these functions, okay? Before we get into specific muscles, is there any questions in terms of how the class is set up for the wrist? Anterior crossing muscles, flexors. Posterior crossing muscles, extensors. Medial crossing muscles, ulnar deviators, lateral crossing muscles, radial deviators. Remember, this must be referenced anatomical, because if I do this, well now, the medial is radial, okay? So this is referenced anatomical, so that way we're all on the same page about what's medial, what's lateral. Cool? All right. Also, these are posted on Pluto. Yay! I thought you guys would cheer. All right. This is cool. Okay, so a lot of wiring, okay? A lot of wiring, a lot of nerves, a ton of nerves. And again, the reason you need so much wiring is for our fine-tuned function. You need a lot of nerves in terms of ratio to motor fibers to be able to do these little intricate things. Nerves take up space. We want to limit, if you have a lot of plumbing and wiring, and we know that there's only so much circumference here, we want to limit how much stuff goes in there, because too much stuff can cause pressure on those nerves, and that's a bad day, right? So what you're going to notice is these muscles turn into inner strings relatively early, so that way their influence doesn't take up as much space as the muscle belly itself. Does that make sense? So in other words, the muscle can pull from far away, but the string that's pulling doesn't take up a lot of space. Also, it doesn't hypertrophy as rapidly, so in terms of getting bigger, the muscle can do that back here, but the string doesn't correlate to that hypertrophy. Even though obviously the tendon is going to adapt and get stronger with it, it doesn't take up as much space. That's a big advantage of having these tendons that start early and run far away. They don't take up as much space. First muscle we're going to talk about in the flexor, wrist flexor group is the palmaris longus. You see that common origin on the medial epicondyle of the elbow. They do cross the elbow, okay? And they run down and then they branch off into different places at the wrist. To me, this is a great example of why necessarily origin, although important to some of you, insertion, although important to some of you, doesn't necessarily line up with function. Because here you have all three muscles that start in the same place, but yet this is going to be a radial deviator, and this is going to be an ulnar deviator, right? Because it's how does it cross the wrist? Not necessarily where it starts, but how does it cross? So I could have a string that starts on the inside of my elbow. If I bring it to my thumb and it crosses the wrist joint laterally, you can bet your butt I'm just going to pull in the direction of radial deviation. So if you think of the AP axis, the anterior posterior axis, kind of like this, even though all three start in the same place, right on that line, right on the axis, sit in the fence. Right. Medial and lateral crossings. So the palmaris longus, first muscle we're going to talk about, I call it the Spider-Man muscle just because it kind of looks at it fans out into what we call an aponeurosis, but it fans out to increase its surface area over the metatarsals. So we have second, third, and fourth. It kind of fans out. That's to dissipate force. If you think about it, it's not putting all of its eggs on one basket. It's kind of spreading out its distribution of force over three, and it helps to get more of a unilateral pull in one direction in terms of flexion. Palmaris longus, a long muscle. Now when I say long, actually that's not true. Longus and brevis, long, short, are actually terms for tendon length. It's actually terms for tendon length. So when we're going to get to some muscles that are called longus and brevis, longest muscles actually are short muscles that have long tendons. So you may say palmaris longus, look how early it ends, so the tendon is what's really long about it, okay? So in layman's terms, just look at it as a muscle that crosses the front of the wrist, that pulls on the palm, you met a carpal or on your palm, and it has a long tendon, okay? So again, in terms of its flexor-only component, it doesn't matter that it started medial. That doesn't mean it's going to pull in the direction of all the deviation. You see what I'm saying? The fact that it started medial doesn't mean it's going to pull medial. Because even though it started medial, what matters is when it gets to the joint itself, how does it cross? And in this case, it crosses it right smack in the middle. Okay? Palmaris longus. Now let's talk about a couple buddies of mine, these little twin muscles, flexor carpi ulnaris and radialis. Flexor pulls in the direction of flexion. The function is suggested, given. Flexor pulls in the direction of flexion. Carpi pulls on, anchors, attaches, inserts, however you want to put it, on a carpal bone. Ulnaris goes to the pisiform. I love the pisiform because you can kind of move it around. And the radialis, I know it's not the scaphoid lumate, but one of these T's over here, anchors over here. The key thing is that by pulling on these carpal bones, when you need flexors, they kind of work as not only mobilizers, but stabilizers as well, right? Remember how muscles can move and stabilize. So you get this translation effect of those carpal bones on the medial side and the lateral side. They can cancel out each other's frontal plane function to work together and pull in a direction of flexion if you need. Real good for mobility and stability. The radial running flexor carpi obviously is going to pull radial side, thumb side. And the ulnar crossing flexor is going to pull ulnar side or ulnar deviation. So flexor carpi, this is the way I like to look at it. I take my two fingers on either hand, and I put them here and I say, flexor carpi radialis, pull direction of radial deviation. Flexor carpi ulnaris, pull direction of ulnar deviation. When they both pull together, they cancel out each other's deviation. They can work together to pull in the direction of flexion. If I only did one, it would look like this. If I only did the other. Okay. Flexor carpi ulnaris, flexor carpi radialis. So, what's the function? If I asked you about functions, two main functions of each. Function of the flexor carpi ulnaris is a wrist flexor and a wrist ulnar deviator. Flexor carpi radialis, wrist flexor radial deviator. How would you stretch the ulnaris longus? By extending the wrist, because it's a flexor. How would you stretch the flexor carpi ulnaris? You want to radial deviate, extend. It's a little tricky because you can't really do those combination of motions because of the closed pec position. But if someone was really tight, then maybe stretching would just get them back to anatomical position. You know, so it doesn't have to be like extreme kind of motion stuff. There's also, this is not going to be a test, but like there's like 7% of you that don't have a palmaris longus. It's kind of cool. Looks like the Dublin Canal right there. Okay, let's look at the back. Posterior. Let me get to the digits. I'll get to the flexor digits before we get to the posterior. Okay, guys, you have these. If I attached a string and I attached it to my middle finger, just because it's lined up with everything. And that string came all the way up to my neck, and I pulled on it. Every joint that string crosses to get to my middle finger, it's going to pull at that joint. What I mean by that is if I pulled on my middle finger, that string is going to pull in a direction of finger flexion. If I keep pulling, wrist flexion. If I keep pulling, elbow flexion. If I keep pulling further, shoulder flexion. Does that make sense? So, even though this muscle is called digit pullers, pulling in the direction of digit, to get to the digits, it has to cross the wrist to get it. Does that make sense? Now, you do have some little intrinsic muscles that do the fingers, but in terms of wrist function, those intrinsic muscles are irrelevant because they don't cross the wrist joint to get there. So we're specifically talking about a muscle, a couple muscles, that cross the wrist to get to the fingers. Now, why is that important? One, once again, when we have muscles that live out in the country, I say live out in the country, pecs, quads, glutes, I consider that the country because they can hypertrophy and not have to worry about squeezing joint nerves and stuff. This is city life. So again, if you think about the function of being able to grip heavy things, it takes a lot of force. More force than little intrinsic muscles can support. So we need some big country muscles to be able to help us lift heavy things. So the country muscles can be big up here, turn into tendons to transfer their force and not have to worry about taking up too much space in the city. Pull on the fingers so that we can grip things, but by getting to the fingers, they cross the wrist to get there. Okay? So we have two major types of extrinsic finger flexors. Finger flexors that cross the wrist to get to the fingers. One is the superficialis and the other is profundus. Superficialis stops about right there, and then the profundus goes all the way to the tips. The mechanics of these are really cool, where like the superficialis makes this little slit and it pulls on each side of the, let's see, distal, proximal, middle interphalangeals, and then the profundus goes in between the slit and goes straight to the end of the distal phalanx. You can see pictures of it, it's really fascinating. But the point is that the profundus goes a little further than the superficialis. Big whoop. Profundus goes a little further than the superficialis. Here's the key though, guys, and again, it should make sense. Muscles don't just serve as movements influencers, they serve as stabilizers. So being able to have grip strength, being able to squeeze something, and at the same time, those muscles are literally preventing your hand from pulling out of your wrist. You know, when you're holding on to something heavy, it's not just about your grip strength. It's preventing this bone from being pulled out of that bone, and this bone from being pulled out of that bone, and this bone from being pulled out of that bone. So being able to pull in the direction of finger flexion while also stabilizing the wrist joints and the elbow joints, you know, bang for your buck. Right? Pretty efficient. So we have several big daddy, well, two main ones, but you have some intrinsics as well. And their job is to hold on to things. The cool thing that you should kind of have already in your life data is that it obviously takes a lot more force to hold on to something than it does to let something go. It doesn't take a lot of force to let something go. And when do you ever use your finger extensors for any kind of strenuous effort, right? Yeah. Watch this, man, I can hold 50 pounds out. So the point is that we have some big daddy finger flexor muscles because we need to hold on to heavy things. But the opposite end is it doesn't really take a lot of force to let something go. So we only have kind of one major muscle that crosses into the digits from the back to release something. We just call it the extensor digitorum. A muscle that goes out into the digits. Now let me show you something cool about the digitorum. And this will kind of play into intrinsic and extrinsic muscles. Y'all know what I'm saying by intrinsic? They are little muscles that are just within the joint, that just works at that joint, but they don't cross outside to get there. They're usually very small, little efficient muscles. Check out this experiment. You're going to need a piece of paper, okay? You just tear a piece of paper from your book. This might win you a drink this weekend. I don't know. Maybe. This shows you that you have certain fingers that need intrinsic muscles for motion, not necessarily for strong things, for dexterity. You have independent little intrinsic muscles for your pinky. You have intrinsic little finger muscles for your middle finger, pointer finger, thumb. But I'm going to show you that we really don't have a function for our ring finger to do anything special. Like this finger points. You don't point with your... right? So watch this, how cool. To show you that your ring finger kind of needs an extrinsic muscle to move it. Did I show you all this before? That is cool. Okay, follow me here. Take the piece of paper and put it in between your ring fingers and then pray. Okay, so all fingers touching, paper in between your ring fingers. Now what I want you to do is do the whole make a bridge with your middle fingers, and then you can kind of do the spider thing. Okay? Now, before you start to move, the first thing is don't disassociate your bridge, okay? Keep your knuckles connected, make sure your bridge stays intact. And then you can notice how I can independently, move my pointer fingers, my pinky fingers. Now here's the challenge. Without taking your fingers away and without breaking your bridge, let go of the paper. Keep your bridge intact. Don't move your fingers. Let go of the paper. And that's because keep your bridge intact. Let's cheating. Okay, so the point is that you do not have specific intrinsic muscles because you don't need to move your ring finger like that. So your ring finger needs an extrinsic muscle like the extensor digitorum to work all at the same time. Does that make sense? It's just an example of what I'm trying to say here. So don't misunderstand me. Don't think, well, this extensor digitorum, I can do this and I can do that. Yeah, you have little muscles that are within your hand that allows those specialized motions. But you also have a big muscle that works to just basically let go of stuff. Okay? Now, to get to the fingers from the back, you got to cross the wrist. And that's what, again, this class is about, is that function is about crossing. So to get to the posterior fingers, that muscle crosses the wrist in the back, and therefore it's going to pull in the direction of wrist extension. Finger extension, wrist extension, finger flexion, wrist flexion. In 310, the easiest way to follow these muscles in the presence of radial ulnar joint motion is follow the fingers. The fingers will show you the wrist flexion, regardless of the radial ulnar joint position. Okay? Follow the fingers. Finger flexion, wrist flexion. Finger extensors, wrist extensors. Okay? All right. Let's get to our extensor digitorum, and then I'm going to talk to you guys about tennis elbow. Yay! Look at all these little hallux. This is important to, I say important, but planting seeds. So in your body, you're going to have some references to hallux and hallux. Hallux is a big toe Latin term, and hallux is a thumb term, okay? So they're similar, but they're obviously not the same thing. So you may see muscles that refer to adductor hallux. And that's also a fun that's not for the purposes of this class, but there's regular anatomical position, and then they kind of give the thumb a special reference for certain things. So what I mean by that is when you grip something, your fingers go down, but your thumb goes up. There's just some different perspectives sometimes of those kind of muscles, and so we're not gonna deal with that for this class. But if you see hallux, just know that's a thumb concept. Let's get to our extensors. There we go. Okay, so this is something I'm working into my lectures in addition to function, some injury issues for my athletic training students, or for those of you that are going to be therapists, for those of you that are going to be working as personal trainers, you may come into contact with some of these things. And that is the natural imbalance of gripping itself, okay? So what I mean by that is anything you grab or grip or squeeze, finger flexors grip something, but remember these muscles also want to do this to your wrist because they're wrist flexors, right? So if you're grabbing or squeezing and you want to keep your wrist in a neutral position, and you turn on these finger flexors and those finger flexors want to do this, well, what's in the back to keep your wrist neutral? Those wrist extensors. Minus the digitorum, because the digitorum is being inhibited by the finger flexors.
Meaning that if you're squeezing something, you're going to reciprocally inhibit the digits to basically say, dude, turn off, I'm trying to squeeze something here. Now, most of the time when you innervate a muscle, you consciously innervate a muscle, right? You turn on something. But here you indirectly innervate. You don't consciously turn on your wrist extensors. They turn on because you squeeze something to keep your wrist in a neutral posture. That's different. That's different. And it's something that makes us special as a species because of our grip and our function. Exactly. Now, think about this, guys. Y'all ever heard of the term tonic and phasic? There's different terms for it. But basically in physiology, y'all talked about like muscles that are prone to fatigue, fatigable, and fatigue resistant. And that's the whole slow twitch, fast twitch. Your flexors, because you grip a lot, those things can work a long time. Your extensors, because they don't get worked a lot, they're more prone to get fatigued. Think of it like this: if somebody starts a walking program, right? Maybe your aunt, your uncle, mama, papa, mom, dad, when they walk for the first time, and it's not uncommon for them not to have so much pain or so. It's the front, huh? Like the front of the shin. Ooh, oh, I feel that in the front. It's because the plantar flexors as a group, pretty fatigue resistant, but the dorsiflexors as a group, they are more fatigable, and they're getting worked a lot more because as you increase your frequency when you heel strike, those dorsiflexors need to turn on to transition from your heel strike to your foot. They're doing more work than what they're used to, and you feel it. So my point is that when you're gripping things, let's say a welder, someone at work, briefcases, just holding on, grabbing things, your finger flexors naturally have more, they're more fatigue resistant. They can work longer without getting tired. But you have to automatically turn on your extensors to counter the flexion moment, the flexion torque that's happening at your wrist. So the point is that muscles like the extensor carpi radialis, brevis, and longus get turned on when you're grabbing and gripping things, even though you're not consciously turning them on. And those muscles are more prone to get fatigued. Those muscles aren't as adapted as your finger flexors. That's what tennis elbow is, guys. Tennis elbow doesn't have much to do with tennis because 90% of the people that have it don't play tennis. They call it tennis elbow because of an indirect mechanism where they say, well, it's pain on the outside of the elbow, your extensor carpi radialis and brevis. And when you do a backhand, it really hurts them. And so what they do is they say, well, it must be, the eccentric nature of the wrist. But what's really happening, which is really cool, is if I'm doing a forehand, that racket isn't going to pass through my palm. But if I'm doing a backhand, my finger flexors are preventing the racket from coming out of my hand. So which one do you think I'm squeezing more? The backhand. It's about the grip. It's about the squeeze. And with people with tennis elbow, the harder they squeeze, the more it hurts. The harder they grip, the more it hurts. And that should make sense because the more you squeeze, the more those finger flexors want to do this. So the more you can recruit your extensors to keep your wrist in a neutral posture. So it's about the grip. And it should make sense too that, people when they're doing tasks for the first time, you tend to over grip on things. I mean, you don't know how hard you got to squeeze. So that's kind of cool that your extensor group kicks on automatically every time you grip something because your finger grippers want to do this. So how do you keep your wrist in a neutral posture? You counter it with what we call neutralizer muscles. Muscles that neutralize other functions to keep your joint where it needs to be. It's kind of cool. Okay. Any questions? So let's review. Make sure we have all that we need for the wrist. All right, guys?
on the test, if I say, how many wrist flexors are you accountable for this class? You would say, if I asked you for a number, 5. Palmaris longus, flexor digitorum profundus, flexor digitorum superficialis, flexor corpi ulnaris, flexor corpi radialis. If I asked you for the functions of the flexor corpi ulnaris, all you gotta say is flexor corpi ulnaris. It's a wrist flexor and it's a ulna deviator. Pulls in those directions, right? I could be specific. I could say, what's the function of the flexor corpi ulnaris in the wrist frontal plane? Well, frontal plane, that's ulna and radial deviation, right? So he's just specifically asking me for the ulna deviator function, pulling in the direction of ulna deviation. How would I stretch the palmaris longus? There you go, absolutely. Stretch it like this. Now, again, this is real cool. These muscles do cross the elbow. We're going to get into elbow function, elbow stuff. So that's why when you stretch like the wrist flexors, when you lock out that elbow, you kind of feel a little bit more because it does cross the elbow. And so when you kind of keep it at its most length here, you're going to feel it on the other end. Okay, you put it on slack. That's no different than if you're stretching your hamstrings and it really hurts you, bend your knees a little bit, it takes that pain away. It's the same thing. Okay. Function of the palmaris longus, it's a wrist flexor. What's its function when it's working eccentrically? Wrist flexor. Pulls in the direction of wrist flexion. Function has nothing to do with contraction. It has everything to do with direction of pull. Okay? Flexor corpi ulnaris, flexor corpi radialis. Watch this. Flexor and extensor corpi ulnaris. See how they cancel out? They could work together this way. So if I had a gallon of milk, if I had a gallon of milk, which group of muscles do I need to recruit to keep that milk in my hand? I need radial deviators, right? Because the milk wants to ulna deviate me. Who are my main radial deviators? Flexor corpi radialis, extensor corpi radialis. Cool. What about what if we're going to stop and observe hammer time? I take that hammer. So here, I'm trying to create speed of the hammer faster than what gravity can route. So I'm probably going to use my ulna deviators concentrically to make that ulna deviation happen faster than gravity. Who are my ulna deviators? Flexor corpi ulnaris. I think the only trap could be, although we learn the function in anatomical, I could do stuff outside of anatomical, but that doesn't change anything. You know? If you know that I have to use extensors, you can still reference that circle to see the extensors. If you know I have to use radial deviators, it doesn't matter how I need to use them. Once you identify I need some radial deviators, you can still reference the circle to see who are the radial deviators. Okay? Any questions? I would strongly suggest you guys learn these, even if you just practice, you look at it and you practice circles, because once we start to get into elbow, radial joint, shoulder, it's going to start to get more and more and more, okay? So stay up on the material. All right, guys, you have a good day.